Hey everyone, and welcome back for another deep dive. We know that a lot of you are new parents, so we're going to be talking about something today that's probably on your minds.
Sure.
The tests available for Down syndrome during pregnancy.
Yeah, it's something that can be a little overwhelming on top of, well, everything else.
Right, exactly. It's definitely a topic that deserves a clear and honest conversation. Let's just start with the basics. What exactly is Down syndrome?
So Down syndrome is a genetic condition, and it affects about 1 in 700 births. Basically, it's caused by an extra copy of chromosome 21.
Okay.
Chromosomes are like these little packages of genetic information in our cells. And this extra copy can lead to certain developmental and physical characteristics.
So it kind of changes the instructions in those cells.
Yeah, exactly. And actually, it's the most common cause of intellectual disabilities and learning difficulties.
That makes sense. So when we talk about those characteristics, what does that actually mean for a child's development?
Well, it's important to remember that each person with Down syndrome is unique, just like anyone else. But generally, it can lead to some level of learning disabilities and often some distinct physical features as well. The important thing, though, is that people with Down syndrome can and do live fulfilling lives.
That's really important to hear, especially for new parents who might be trying to process a lot of information.
Yeah, absolutely. I know the thought of testing during pregnancy can be stressful, but why is it so important to understand those options?
Well, I think understanding your options can empower you to make informed choices that really align with your family's values and priorities. It's not about what's right or wrong, but about what feels right for you.
So when we talk about these tests, what are the main types that are available?
So there are two main categories. We have screening tests and we have diagnostic tests. Think of screening tests like they're taking your temperature. They just kind of give you an indication of whether there might be something going on.
An elevated risk, but diagnostic tests, on the other hand, they're more like taking a closer look. They provide a definite answer.
So screening is kind of like a risk assessment,
Yes.
and diagnostic is a more definitive yes or no.
Exactly.
Can you walk us through each of those a little bit more?
Yeah. Let's start with the screening tests. There are two primary ones that you'll probably hear about. The first is first trimester screening, we call that FTS. And then there's maternal serum screening, or MSS.
Okay, so FTS and MSS, what's the difference between the two?
So FTS is done during the first trimester, usually between 11 and 14 weeks. It involves an ultrasound and a blood test.
Okay,
And they're looking at a very specific measurement in the ultrasound. It's the thickness of the neutral translucency, which is the area at the back of the baby's neck.
interesting. So there's something they can actually see on the ultrasound that gives them information.
Exactly. So a thicker measurement in that area can be associated with an increased risk of Down syndrome, but it could also be associated with some other conditions. So it's not a for sure thing.
Okay.
Now, MSS comes a bit later, between 15 and 20 weeks, and this one is just a blood test.
Gotcha. What are they looking for in the blood then?
So they're measuring the levels of certain hormones and proteins that, when combined with your age and other factors, can indicate a higher chance of the baby having Down syndrome. One important thing to know about both FTS and MSS is that they're considered non-invasive.
What does that mean?
It means that these tests don't pose any risk to the baby or the pregnancy.
Okay.
It's simply taking some observations, some measurements. There's no risk of miscarriage associated with those screening tests.
That's really good to know, especially, like you said, when there's so much else going on. But I think it's important to reiterate that these screening tests don't give a definite yes or no answer.
Yeah.
It's really about the probability, right?
Right. They're not diagnostic. So, for example, you might get a result that says there's a 1 in 300 chance.
Okay.
So even with a low-risk result, there's still a possibility, however small, of the baby having Down syndrome.
And that's where understanding the difference between the screening and diagnostic tests is so important.
Yeah.
So let's talk about those diagnostic tests then. What makes them different?
So diagnostic tests are the ones that will give you a yes or no answer about the presence of Down syndrome. The two most common ones are amniocentesis and chorionic villus sampling,
CVS.
or
Okay.
CVS, exactly.
I've heard those terms, but can you remind me again what each of those involves?
Yeah, so amniocentesis is usually done between 15 and 20 weeks of pregnancy. It involves using a very thin needle to collect a small sample of amniotic fluid from the sac surrounding the baby.
So this one does involve going into the womb.
Yes, it does, and that's why it's considered an invasive procedure.
Okay. What about CVS?
So CVS is done a bit earlier, usually between 11 and 14 weeks. It also uses a needle, but this time it collects a small sample of tissue from the placenta, which shares the baby's genetic makeup. And like amniocentesis, it's done with ultrasound guidance to make sure that it's accurate and safe.
So both of them are about getting a sample, but because they are invasive, are there risks involved with that?
There are. Both amniocentesis and CVS carry a small risk of miscarriage, which is why they aren't routinely offered to every pregnant woman.
That makes sense. So it sounds like if someone gets a high-risk result from a screening test, that's when they might consider one of these more invasive diagnostic tests.
Exactly. It becomes a decision of weighing the need for a definite answer against those potential risks involved. And that's where conversations with your healthcare provider become really important.
Yeah, it sounds like there's a lot to consider: the accuracy, the risks, the timing. It's a lot to think about, especially for new parents. And then, of course, there's the emotional weight of all of this.
Absolutely. These tests and the potential implications of their results can bring up a whole range of emotions for expectant parents. It's a lot to navigate.
Yeah, it really is. I mean, it's not just about the information, but also what it means for you and your family.
I can imagine. It brings up a lot of uncertainty, a lot of what ifs.
Definitely.
What are some of those emotional challenges that parents might be facing when they go through this process?
I think anxiety is a big one.
Huh?
Just the fear of the unknown, worry about your baby's health, concerns about what the future might hold. All of those feelings are completely valid.
Right. And I mean, there's the weight of making such a big decision, too.
Absolutely. That decision-making process can feel incredibly heavy. It's not just medical facts. It's about your personal values, beliefs, and what kind of life you envision for your child and your family. It can bring up a lot of guilt, doubt, did I make the right choice, and
Mm.
all of that. I bet. So it sounds like having a support system during this time would be really crucial. Who are some of the people that expectant parents can lean on as they're trying to navigate all of these, complex emotions?
Well, first and foremost, they're healthcare providers. They're doctors, nurses, genetic counselors. They're not just there for the medical side of things. They can offer emotional support too. So, talk to them about your fears, your hopes, your uncertainties. Ask all the questions you have.
Be open and honest.
Exactly.
Yeah.
And then beyond the medical professionals, there are support groups, both in person and online. Connecting with other parents who are going through similar experiences, I think that can be incredibly validating. It helps you realize you're not alone in how you're feeling.
Yeah, absolutely. That shared experience can make a world of difference, knowing that you're not the only one wrestling with these emotions. So we've talked about, the science behind these tests, the emotional aspects, the importance of support. When you put all of that together, what does it mean for these new parents who are trying to make these decisions?
I think for me, it really boils down to this. Knowledge is empowering.
Okay.
The more you understand about the different tests, about their accuracy, the potential risks and benefits, and what the results might mean for you and your family, the better equipped you'll be to make a decision that feels right.
Not just informed, but right for your family.
Right. Every family is unique. Every situation's different. There's no one-size-fits-all approach here.
And I imagine having those conversations with your healthcare providers, once you have that deeper understanding, becomes even more crucial.
Yeah, absolutely. You can advocate for yourself and your family with more confidence when you are well informed.
So what's the first step? If a new parent is listening and they're thinking, okay, I really want to learn more, I want to delve into this and figure out what feels right for me, where do they begin?
I always say the best place to start is with your doctor or your midwife.
Okay.
They can answer your specific questions and help you understand what options are available to you based on your individual circumstances.
No, so it comes back to that communication.
Exactly.
And just remembering that you don't have to go through this alone. There's a whole network of support out there. So as we wrap up this part of our deep dive, I want to leave you with something to think about. As you move forward in your pregnancy journey, what feels most important to you in making these decisions about Down syndrome testing?
That's a really personal question and one that I think deserves a lot of thought.
Yeah, it goes beyond just the medical facts. It's about what you hope for your child, your family values, and what feels right in your heart as a parent.
It's figuring out what matters most on this journey. It might involve some deeper conversations with your partner, or seeking guidance from family members, friends, or even connecting with your own spiritual beliefs.
It's a process. It's really reflecting and figuring out what feels right for your family. And it's okay to change your mind along the way too, or ask for more information as you learn and as you process.
Absolutely. You have the right to make informed choices and advocate for what feels best for you and for your baby. And remember, no matter what choices you make, you are not alone. There are so many resources available to support you: your healthcare providers, support groups, online communities. You can find strength and guidance from connecting with others who've walked a similar path.
It's a good reminder that parenthood, with all its joys and challenges, is definitely a journey best shared. And we're here to support you every step of the way. Even though our deep dive is coming to an end, your exploration of this topic doesn't have to. Talk to your doctor, reach out to those support networks, and keep asking questions.
Knowledge is a powerful tool, and the more you understand, the more confident you'll feel as you navigate these decisions.
Thank you for joining us on this deep dive into Down syndrome testing during pregnancy. We hope this has given you a clearer understanding of the options out there, the emotions that often come with those options, and the importance of making informed choices that feel right for your family. Wishing you all the best on this incredible journey of parenthood.